Okay. All right, welcome. Welcome to today's Empowering People Community series. Today's webinar is caring for loved ones with cancer, supporting African American families facing lung cancer with limited resources. Again, welcome. We're happy that you're here with us today. My name is Michelle Ozai, and I'm the Social and Health Disparities Senior Coordinator. I am the Managing Coordinator of the Empowering People Community Series. About the Louisiana campaigns for tobacco-free livings, empowering people and communities. The Louisiana Campaign for Tobacco-Free Living understands that an essential action of health equity is building the capacity of individuals and communities. Thus, TFL has developed the Empowering People and Community series. The series consists of educational events, virtual and hybrid, coordinated by TFL staff featuring stakeholders such as guest speakers, guest presenters from public health, policy, medical, community advocacy, and subject matter experts to reach professionals and community partners and members across the state of Louisiana and beyond. The mission of the EPCS is to equitably bringing health education, resources, and hope to people, populations, and communities in Louisiana. We also want to increase the awareness and empower people, populations, and communities about tobacco and tobacco-related concerns or tobacco-related health and non-health disparities. Now we will have our moderator for today, Ms. Maddie Hawkins, who is our regional manager for the Louisiana Campaign for Tobacco-Free Living.
Awesome. Good morning. Thank you, Michelle. Once again, as you said, my name is Maddie Hawkins, and I serve as the South Central Regional Manager for the Louisiana Campaign for Tobacco-Free Living. And I just want to thank you all for joining today. This session is a continuation of our Caring for Loved Ones cancer series, with a focus emphasized on lung cancer as a unique and the unique challenges it presents for families and caregivers, particularly within African American communities. You can go to the next slide, Michelle. As we know, lung cancer remains the leading cause of cancer-related deaths, and many of the disparities we see are deeply rooted in access, awareness, and systematic barriers. Today's conversation is not only about education, but also equipping families with practical tools, culturally relative support, and real life insight to help navigate this journey. This topic is very personal to me. I've had experience of caring for a loved one, my father, who battled non-Hodgkin's lymphoma and is currently battling prostate cancer. While he was a smoker for over 50 years, he was not diagnosed with lung cancer. However, his journey was a powerful reminder that tobacco use doesn't just impact one area of health. It increases the risk of multiple cancers and chronic conditions that can deeply affect individuals and families. So for me, this work is more than professional. It's personal. It's about making sure that families have information, support, and resources they need, especially when navigating complex diagnosis with limited resources. Today, you'll hear from some phenomenal speakers as they share their stories, lived experiences, and insight on how we can better support caregivers, improve outcomes, and ultimately save lives. So, next slide. So, some of the learning objectives for today, we want to identify disparities impacting African American communities in lung cancer diagnosis, treatment access, and outcomes, and also recognize the emotional, physical, and financial challenges of caregiving when resources are limited, and navigate available community-based healthcare, tobacco cessation resources that support lung cancer patients and caregivers. Next slide. So for our speakers today, we have Mr. Eric Weinzettel, the Director of Advocacy for the American Lung Association. We have Dr. Lawrence Sanders, who's the Chief Medical Officer of the Hill Collaborative. We have Ms. Jamie Knox, who's the WMJS radio owner, lung cancer survivor, and also patient advocate. And we have Mr. Reginald, the Chief Operations Officer of Crescent Care Community Health Center. So thank you all for joining us today, and we're going to get right into it. So up first, we're going to have Eric.
Thank you, Maddie. Hello, everybody. My name is Eric Weinzettel. I'm the director of advocacy with the American Lung Association. And so, what you see to here on the screen are several of the areas that we look at in our yearly state of lung cancer report that we publish. Um, so it's released in November and to coincide with Lung Cancer Awareness Month. It was our eighth edition, and it shows how the toll of lung cancer continues to vary by state. We examine the rate of new lung cancer cases, survival, early diagnosis, surgical treatment, lack of treatment, screening among those at high risk for lung cancer, and insurance coverage for comprehensive biomarker testing. The state of lung cancer found low screening rates and that states must do more to protect their residents from lung cancer, and also includes data on racial and ethnic disparities for the above measures where available, showing that people of color who are diagnosed with lung cancer face far worse outcomes than white individuals. The report provides policymakers, researchers, healthcare practitioners, and anyone committed to ending lung cancer um, a foundation for identifying where their state can best focus its resources and decrease the burden of lung cancer. So nationally, this year's report found that the 5-year survival rate increased by 26% to 29.7% over the past 5 years. Um, Many of the stories we hear is that through research done at NIH, through screening and coverage provided by CDC and through Medicare, uh, this is not the lung cancer that we once knew. The prognosis we're seeing for survival is only getting better and better, and we hope to continue that trajectory by continuing funding for NIH and then continuing awareness, as we talked about, and getting those who are eligible to be screened to get screened so we can catch it as soon as possible. However, only 18.2% of those eligible were screened for lung cancer, and this data goes back to 2022 was the most recent data that we had. But despite, even though screening being a key part to early diagnosis, and as we know, early diagnosis saves lives. And unfortunately, the sad reality that we have is that people of color continue to face worse outcomes compared to white individuals for most measures in our report. So, for those who may not know what the screening guidelines are for lung cancer, it's for anyone aged 50 to 80 with a 20 or more pack years, which means someone who smoked for 1 pack a day for 20 years or 2 packs a day for 10 years, or any combination of there in between, and it doesn't have to be continuous. It could be any of those in total over your lifetime, and it's someone who currently smokes or has quit within the past 15 years. So whenever I first saw those numbers, my first thought was that this was extremely restrictive, right? That's a very high threshold to meet. However, even though they're quite restrictive in Louisiana, only 17% of this population were screened. Back in March, one of the things that the Lung Association does is we host our Lung Force Advocacy Day, where heroes with lung cancer stories come to DC to share their stories with lawmakers and advocate for better lung health outcomes. One of the things we talked about was that lung cancer is one of the only cancers that comes with a stigma. When someone gets diagnosed with breast cancer, no one asks what they've done to cause it, but people feel all too comfortable asking if someone diagnosed with lung cancer smoked. But regardless of the answer, no one deserves lung cancer. Although smoking is the number 1 cause of lung cancer, it's not the only reason. And as we know, the only pre-existing condition needed to get lung cancer is to have lungs. Louisiana ranks among the worst in the nation for new lung cancer cases, and lung cancer remains the number 1 cause of cancer deaths for both men and women. According to our report, Louisiana overall, our incidence rate is 61.1 cases per 100,000 people, which is significantly higher than the national rate of 52.8. And unfortunately, African American individuals are less likely to be diagnosed early, receive timely surgical care, and achieve 5-year survival compared to white individuals. So there's plenty to be done still, but there is progress being made, and hopefully, as we continue to have these conversations, both at the local, state, and federal level, we can continue to improve these outcomes and make change. Thank you.
Thanks so much for that information, Eric. Up next, we will have Dr. Sanders.
Can you hear me?
Yes, sir.
I think my job over the next few minutes is to really talk about the Hill Collaborative and what the Hill Collaborative does around lung cancer and why that's important. Hill is a community organization that focuses on equipping people to face and empower them to really deal with health issues to try to achieve health across all of our communities. The aim is to really empower people to do advocacy, to educate each other, and to assure access to sufficient health services. We partner with grassroots organizations and neighborhoods and communities across the US. The aim is to deliver culturally relevant information, education, and wellness that will really help people make good decisions. We talk about early detection, screening. I think the previous speaker talked about lower rates of screening. I think one way to increase screening rates is really through education and communication and really awareness, allowing people to educate each other because there's something about trust in communities that will really help people get to screening. We aim to help individuals navigate the healthcare system, try to connect them with resources provided by health systems to navigate the complexities of our healthcare system. Sometimes I wonder it's really hard to get from point A to point B in our healthcare system without some help or without somebody being there to advocate for you. As I said earlier, our work aims to build trust and to increase awareness and to equip communities to make good decisions related to health and to build coalitions and to work together with other resources. I think we have the American Cancer Society here. I think we have the tobacco advocacy group for the state of Louisiana. And I think that's all important. And more importantly, we really want to invite you to the third annual Lung Cancer Patient and Caregiver Summit that will be held in New Orleans. It is a gathering of patients, caregivers, clinicians, and advocates to really talk about lung cancer. This year's theme is Our Voice, Our Breath, Our Future, and it centers on shared experience. The goal is to really have people communicating with each other and to leave better equipped. The event starts with our pre-summit information on Thursday, April 23rd, and it will include a lunch, access to caregivers retreat, and registration for this is required. And it's really designed to help patients and caregivers understand their roles. I'm going to stop there and see if there's any more that you want me to talk about, and I can come back and talk about clinical trials and other things and tie that all together if you like.
So, Dr. Sanders, we're going to go to Jamie next,
Okay.
and we'll come back to you once we finish with Mr. Reginald.
Okay.
All right. Good afternoon, everybody. I apologize. I am battling some kind of cold, and so I will not be with you long speaking, I promise. But I really just wanted to first thank you guys for your time today, but also share my experience as a patient and also a consultant with HEAL working with the Lung Cancer Patient and Caregiver Summit. So this is our third year running. Again, we're going to be in New Orleans, Louisiana, which, as you know, is a hotspot for cancer activity and just underserved populations and missed opportunities for people to get the word out. And so we are excited because this summit, and I've been here with the summit from the beginning, from inception to actually seeing it take place and being on both sides of it, from patient side to actual, running it side it's amazing to see. And I will say that I've been through quite a few different summits and panels and, different events where we have lung cancer centered conversations. And the HEAL Collaborative Summit always seems to be just a little bit more close to home and just a little bit different. The reason for that is because the information that you receive at the summit is one that is tailored directly to our community. It's going to hit us in areas where, we're hosting these events in areas where traditionally people aren't going. And we're looking in those communities to find folks that are going to be affected by the diseases that we're talking about. And so I'm just excited because number one, for us as patients to be able to be in a room full of other patients, scientists, doctors like Dr. Sanders, experts, and even the pharmaceutical companies sometimes is honestly it's overwhelming because in such a lonely diagnosis community, it's overwhelming to find so many resources and support. And I can say last year, the representatives from Genentech were there. And Genentech is the makers of the medication that I myself take as a lung cancer patient. I was able to sit and chat with the makers of my medication for over 45 minutes and just discuss with them, hey, these are some of the side effects that I'm experiencing. These are some of the obstacles that I've run into, even getting access to this medication because it is expensive. And I got their cards, and I walked away knowing, hey, if later on down the line, God forbid something does happen, I literally know the makers of my medication. And I know that I could reach out in good faith and say, hey, I'm needing a little bit of assistance in getting this medication or getting over some of these obstacles to get access to the medication. That's not something you get in any kind of other summit opportunity. The opportunity to actually just speak to the people that actually directly affect you. Not only that, but you're also surrounded by state legislators and politicians who will make the decisions for the bills that will be passed that will affect how you receive your care and whether or not you actually get the quality care that you need. So being in a room full of these kind of folks and actually having those folks listen to you and what you have to say as a patient is so empowering and it's so impactful to us as patients. And so I'm just here as not only an advocate for the Heal Collaborative, but an advocate for lung cancer and an advocate for spaces that talk to the people that they're actually servicing. So, hope that we can see some of your friendly faces there this April 23rd. But yeah, I'm just really grateful that you guys gave me the opportunity to speak today and to share my experience and why this summit is important to patients and folks alike. Oh, and if there's any
Awesome.
questions,
Oh,
you can ask me. Sorry, if there's any questions, me and Dr. Sanders are happy to answer.
awesome. So we'll get to the questions later on in the webinar, but thank you so much, Jamie. Up next, we'll have Mr. Reginald.
Hey, good morning. It's morning here in New Orleans. Not sure what you're experiencing where you are. The Thanks for the opportunity to speak on this topic of lung cancer and cancer prevention. I'm also a lung cancer survivor. I'm 5 years out from treatment and doing well so far. Um, hadn't been to a provider in about 10 years and noticed something unusual. Um, Thought it was a lymph node and ended up being diagnosed with cancer. What I will say, in this intro piece is that um, there are many social determinants of health that impact individuals' ability to access the services that they need. Uh, I'm also a registered nurse, been a registered nurse for about 40 years. And I've seen in my practice and in my experience as a clinician, uh, great disparities in how people can access care, how they can pay for it, um, and being able to access the latest and greatest, best technologies in order to treat their disease process. Um, some of us have been very fortunate, but there are many in our community who are not really knowledgeable and therefore do not know how to advocate for themselves. I'll use myself as one example. I was diagnosed right around the time of, uh, so it was between COVID leveling off and in the process of trying to initiate my treatment, a hurricane hit the city of New Orleans and knocked out power for almost 10 days. Um, I was able to work with some practitioners and develop a plan for myself to move to Dallas, Texas to start my treatment because it hadn't started and it couldn't start in New Orleans. Um, had I not had a team of individuals who were really advocating on my behalf, my treatment would have been delayed, and I have very aggressive cancer. Uh, but again, for many people in our community, they would have languished in that position until the resources came back online in New Orleans or in other regions where they might live. So I was introduced to the HEAL Collaborative just this year. I've been doing some work with musicians and culture bearers in the New Orleans community, and there's great disparity in how they can access care and treatment for a variety of medical conditions as well. And was invited to present on some information about myself, but also uh, because of the work that we do as a community health center in this area, speak to some of the opportunities that community health centers present to individuals who struggle with access to quality care. And I'll speak more about that as we get into this conversation. But thank you for having me, and I'll pass the mic back to Maddie.
Thank you so much, Mr. Reginald. And now back to Dr. Sanders.
I think my mic is back on now.
Yes.
I think you heard the story about diagnosis, you've heard the story about treatment. So I'm going to talk a little bit about clinical trials and why they are important and why participation in clinical trials is important to achieving the kinds of improvement in outcomes that we heard about earlier. I think one of the earliest speakers talked about improvement in survival rates for lung cancer and that improvement, and that it is a combination of research, screening, and new treatments. One of the things I would say is that the research is really the infrastructure or the foundation that's led to many of the improvements we see today. For example, screening. Screening came out of research to understand that screening works, how to make the screening, what the guidelines are for screening, and new treatments come out of research. Clinical trials are the bedrock, if you will, of research in healthcare, because clinical trials help us compare our existing treatments to new treatments and to determine which one is more effective. You know, sometimes most of us would say, I don't want anything to do with research and people experimenting on me. Well, that's really not the bottom line with clinical trials, because we would use that same approach to improve most things that we do. Even if you're cooking, you'll try something, then you'll try something a little different, and you'll try it differently, and then you get better and better. So without that research, we can't get to where we need to be. Now, what is a clinical trial? A clinical trial is a series of research activities or a series of activities. There are really four phases, really. The first one is to make sure that whatever we're going to do that's different is safe. So we look at a small group of people to make sure to see what the side effects are, to see what kind of harm it might cause, and to determine if it's safe to use this particular medicine, this particular treatment, or this particular diagnostic test. So it could be any number of things. The next thing is, does it work? That's really caused kind of clinical trials phase 2. Does it work? We begin to use it on people with a given condition to see if there's improvement, to see that it works and that it is effective. The third thing with clinical trials is that we then look at the clinical trial across a broader population of people with the condition that we're trying to either test a new treatment, test a new diagnostic test, or test a new approach, Often it's a new treatment where we're comparing the old treatment to a new treatment, and we do it across a broad range of people to make sure that it works in different populations. So many things affect the way medicines work. I think somebody talked about social determinants of health, and I'll use that just as a uh, example. It's really the conditions where people are born, where they grow up, where they live, where they work, and where they grow old, and where they die. It's where so many people live in the same communities. It's the things that happens in that community: housing availability, exposure to environmental toxins, exposure to environmental pollutants, access to education, access to fair jobs, access to sidewalks and places where people can get exercise, access to fresh food, not always food from, um, not always access to just prepared food or food that's processed and in bags and cans, but actual access to fresh fruits and vegetables. All of those things take place in the communities that we live in, and it's important that we look at medicines, especially new medicines, as to how those things that we call social determinants of health and other factors in neighborhoods and communities affect that drug or affect the outcome of that new treatment. So it's important that diverse populations participate, because if you don't participate, we don't know. And the other thing I would say about clinical trials is that clinical trials can give people access to new treatments that they might not otherwise have access to, and therefore become on the leading edge. So I know there's a lot of concern about people participating in clinical trials. I think the main study that everybody references when it comes to research is the Tuskegee study and Tuskegee syphilis study or experiment. I would say that since that time, scientists, the folks that oversee clinical trials, have put in safety measures to assure that trials are equitable, fair, and safe. And with the information that we have available today, we're able to look and advocate for ourselves as we need to. So it is important that we continue to, one, support clinical trials, support the research, advocate with our elected officials to make sure that those funds are allocated to support research, and research does not dry up in this uncertain period of time. And that we then, as African Americans and other diverse populations of people, participate in clinical trials so we can assure that they work in our communities and that we can reap the benefits as well as other populations of people. I'll stop there and see if there are any questions, and we can come back later. All right?
Awesome. Thank you so much for that. Do we have any questions thus far, Michelle, in the chat?
No, there are not any questions in the chat.
Okie dokie. Well, if you all have any questions, can you please share them in the chat? Um, but I do have a question. Given like the impact of, late stage diagnosis, what should communities know about lung cancer screenings and how can we increase awareness and trust around early detection?
I'll take that. And then I'll be quiet and let the other two speakers speak to it as well. But I think that if I were to say, the most important thing is to build a good relationship with a primary care physician. And what I mean by that is a physician that you believe listens to you, a physician that believes has your best interest, um, and has the knowledge base to know the importance of screening. So I think that's important. And that you can then have a fair and honest conversation with that physician to one, determine what screenings you need. And I think it also is important that we each understand the importance of screening and that it does, if the lung cancer is detected earlier, it has a higher probability of responding to treatment and having better outcomes. But it's so hard sometimes because people just don't want to get screened because they just don't want to know. And sometimes they feel like if I get screened and, if people are going to think not, I think bad about me, or that it's a consequence of smoking, which people already have some guilt about. So I do think that we have to look at all of those things. And it's through conversations in neighborhoods and communities with people that we know and trust that helps us
Mhm.
negotiate all of those things in terms of stigma, finding the right physician, being comfortable finding a primary care physician. If you don't like the one you have, you're paying, move to the next one like you would with anything else until you can find one that meets your needs and matches with the things that you need. And to me, the most important thing there is listening, and that then we can get into treatment and we can support each other because one, getting screened has a lot of anxiety and emotional content to it. So I think we have to be there to support each other. And I think that's part of what we try to develop in the neighborhoods that we touch as HEAL.
Awesome. Thank you so much. Any of our other speakers?
Yeah, I can jump in on that as well as speaking from a patient point of view. When it comes to screening for lung cancer, folks need to understand that it's not as scary as you think it is. It's just a low dose CT scan. It takes about 5 minutes and you're in and out. There's no blood work or anything like that. And one of the main things is like you have to really push for it, especially if you're someone who falls outside of that screening criteria. If you do not hit that 50-year-old 20-pack year history or anything like that, like Dr. Sanders said, you're going to need to have a good primary care physician who can push this for you and really go to bat for you with both the insurance companies and the doctors to make sure that you can get it done. But it is possible if you fall outside of that screening criteria. But the advocacy for yourself is what is going to play a major part in your ability to get it done. But it is not a scary process. It's not hard and it doesn't take a long time either. It's just a matter of getting past that initial threshold of getting your foot in the door to get it screened and get it set up and scheduled. But yeah, it's really not a hard process at all.
Right. No, I think the process is easy, but I think Jamie, Ms. Knotts just made a good point. If you believe that something's wrong or that you've got a symptoms that are not getting better or you just got a concern, then that's when you need to go and really talk to your primary care physician and explain what's going on. And they need to listen.
Mm-hmm.
And I think the word of self-advocacy, knowing that you know what's going on with you better than I do as the physician, and my job is to listen long enough to be able to understand, is fundamental. And I really want to reinforce that because I think that's true with screening. I think that's true with treatment and all of the things we're talking about.
And if you've got a history of cancer in your family, you can also use that as a way in as well. So,
Good.
having that primary care that's really tuned in with you will help you find loopholes around your insurance company so that you can get in there and get scanned and get screened and taken care of. So, use whatever resources you have to get that screening done because it is life-saving once you do get it.
Yes.
I would also add that the the lens of prevention is really important in this space, especially when we're talking about screening. And a lot of times we're disease focused as clinicians, and we're not prevention focused. Insurance companies operate in a disease focused model, not necessarily always in a prevention focused model. And so, Dr. Sanders mentioned this earlier about community education, but I also feel like in addition to that, we need additional provider education.
Mhm.
In many instances, providers are not exposed to the public health environment, and so they don't have that perspective of social determinants of health having a significant impact on the health and wellness of the community. because their training is focusing on disease and disease eradication. And so, in many instances, so it's really important that from an advocacy perspective, um, that in speaking to our, clinicians who take care of us, uh, we almost demand that, they give us education on how we can prevent disease and how we can protect ourselves from, to the best of our ability, manage our risk factors, I guess is a better way to put it, in the communities that we live in. Because many times community members don't understand the risk factors of the environment, the risk factors of the type of nutritional products that they ingest, and they don't really have a clear picture of why smoking is so impactful and can drive the disease, not just in the lungs, but in other systems of the body. Um, and so, I just wanted to highlight that in the work that we're doing as a community health center. Public health is our focus. And so we spend a lot of time um, trying to educate and working with the community to ensure that they understand how to advocate for themselves, but also how to prevent disease or chronic disease exacerbation.
Right. I'd actually follow up on that, and I think you're absolutely right that prevention is important. And I think of prevention in two steps. There is primary prevention and secondary prevention. I can put that in perspective real easy. When we're talking about lung cancer, screening is secondary prevention. It's early detection. Now, that's good, but you already have the disease, and so it's important. But I think that primary prevention, which I think Mr. Vicks was talking about, particularly as it relates to the work done by community health centers and some primary care practices, it's really about doing things to prevent the disease such that you don't detect it early because it's not there, if that makes sense. And, it's not only about lung cancer when it comes to prevention. It's really, if you do it right, the same activities that prevent lung cancer also help protect you or prevent other conditions and diseases. For instance, smoking. We need to get rid of the advertisements. If you look around, you see them all over the place. And they tend to want to make it seem acceptable and hip and cool. So you see that then impacts it. So we got to get rid of that. But let's go back to another basic point. What's on your plate every day? What I say to people is the more color you have on their plate, the healthier it is for you. We're getting a lot of confusing information in today's uncertainty around what's good, what's not good. The one thing I will tell you is if you increase fresh fruits and vegetables, you can't go wrong. And the third thing I would put on that table around prevention is some kind of physical activity every day. If it's just walking, uh, something that gets you to the point of where you're focused on that activity. Walking is a good place to start. If you have access to other equipment, uh, exercise classes are good, but some kind of physical activity at least 2 to 3 times a week will help with a number of things. One, it gets your blood flowing. It helps clear your mind. It helps with your both physical and emotional well-being. So those are the things that I would want to put on the table as important to prevention. Screening is important because early detection leads to better outcomes. Later detection, outcomes are not quite as good. Prevention helps to prevent the disease from occurring in the first place, such that the screening is negative. Didn't say you didn't need to be screened, but it helps to make sure that the screening is negative. And I hope that makes sense in terms of the role and importance of prevention in all of this and in trying to achieve health.
Dr. Sanders pretty much started us off with this next question. Lung cancer continues to be disproportionate impact in the African American communities. From your perspective, what are the most critical factors driving these disparities, and where should we focus our efforts to create meaningful change?
All right, I'll take that. First of all, African Americans bear a disproportionate burden of disease and injury in this country. And it was first documented in the early 1900s and has continued throughout the 1900s and into the 20s. So that's an important framework, that it's not just about the individuals, but there must be something that's going on in environments that allow this disproportionate burden of disease to go from generation to generation to generation. All right. Now, that's a broader picture. We may not be able to fix all of that. But when you think about it and you think about the neighborhoods and community, really the neighborhoods where we live, we're probably more likely to be exposed to environmental toxins, to pollutants that have influence on lung cancer and other diseases. We're less likely to have access to fresh fruits and vegetables. Um, and more dependent on processed foods or fast foods. For some reason, we often find more fast food outlets in many neighborhoods than we find real grocery stores. And some neighborhoods have really become dependent on the local convenience store, not only for convenience stuff, but for food as well, because that's really all that's there. So it is all these things compounded. Plus, if you look through our neighborhoods, we probably have more ads and more marketing or advertisements, probably a better word there, for cigarettes and alcohol than any other neighborhood per square mile. So I think that, and as a result, um, particularly among Black men, less so among Black women, smoking is more frequent than in the general population. So I think we just have to work together to get people, one, to quit smoking, to eat right, and exercise.
Awesome. Okay. Any of our other speakers would like to tag along to that?
I can jump in. Not an expert, but in my opinion on access and barriers to care, definitely is the community that you live in and the facilities that support that community. So if you're living in a neighborhood or an area where your health system is not up to par, so whether it's, you're just depending on urgent care or you just have, just a community clinic or something like that, 9 times out of 10, they're not going to have the latest and greatest technology. They're not going to have the latest and greatest, data and information to present to you. And so the bigger facility that you have may be too far away for you to get to, or it may be, out of means for you to get to, or out of means for you to afford. And so they're going to be the ones with the state of the art equipment and the state of the art, diagnostics for you. I know, speaking personally, if I hadn't treated where I treated, I don't know if biomarker testing would have been done for me, and so that was one of the key game changers for why I'm still here 7 years later with stage 4 lung cancer, is that I had that biomarker testing done and they discovered that I'm ALK positive. And so I've been on targeted therapy and I've been able to take that to maintain my lifestyle. But had I just gone to a regular clinic or something like that, or didn't have access to that facility, and they just tried to hit me with chemo and radiation, I may not be here with you guys today to have this conversation. And for more people that I'd like to think about, that's the case. They don't have access to that facility. They don't have access to that state of the art care team who's going to take the extra step to say, let's do biomarker testing on this patient to see if they may be able to use a TKI instead of, chemo and radiation. And we lose a lot of people to just not having access to that state of the art information and that state of the art care. So whether that's because they can't get to it, whether that's because they can't afford it, or whether that's just because the doctors just aren't offering it, there's a couple of things that make that true, and it's really sad. And that's one of the things that I've noticed and why I've been so grateful and try to pay it forward whenever I can, that I was blessed enough to have a care team that cared enough to do that for me, because that's not the case for everybody. So, and I think that's one of the questions in the chat actually talks about biomarker testing. So
Mhm.
that's probably a good transition into that question.
Yes.
Because for me, I wouldn't be here today without it. And so I'm just super grateful that it was done for me.
So let's talk about biomarker testing.
Okay. All right, I'll talk a little bit about it and then we can come back. But biomarker testing identifies certain proteins and certain characteristics of the cancer cells that are present and allows us as physicians and treatment centers to target the treatment to that particular type of cell or to that particular protein. I think one of the things, and Jamie was really important in this in Georgia when she was living here, is making sure that Medicaid programs and other insurance programs cover biomarker testing. And I think there have been initiatives in most states across the Southeast to make coverage for biomarker testing uh, a requirement for all insurance carriers, because that is the first step, is making it available. And I want to go back to what Mr. Vick said early on, is that I can talk about educating patients all day long. But I also have to remember that I have to work, not me personally, but we have to work together as professionals to assure that physicians and other clinicians in our neighborhoods and communities get the necessary education and understand the population of people that they're caring for. And we, as people who live in that neighborhood or that community, may have to advocate for that. We may have to ask questions. May have to work with centers like the one that Mr. Vix is associated with, that are designed to meet the needs of people in our communities. And so I think that's really important. And uh, you know, I sort of started by saying is that find a physician that will listen to you, and I say that with all due respect, because I think if a physician or other clinician is willing to take the time to listen, they are, or is committed to take the time to listen, and that's part of how they do their work, they're also going to be committed to staying current. That those two characteristics tend to go together. And Jamie's used the word a couple of times. One of the things I learned in medical school is that the best way to care for a patient is to care about them. So I think that combination of things for the physicians we choose is extremely important. But biomarker testing, I don't want to lose that thought. It's important. As advocates, we need to make sure it's available and covered by insurance. And we need to make sure that physicians are offering. And I think Jamie said something else very early. If the physician doesn't offer it, ask for it. you know do your own work, find you safe sites that will give you information about what your options are, and be willing to talk with your physician or other clinician about those. See, I'm old enough to remember the first time a patient brought in a computer printout into me from the internet and ready to talk about it. At first I was like, what? But then I realized that it was about building on shared knowledge, and so that's really what's important.
Thank you for that, Dr. Sanders. And for Mr. Reginald and Jamie, throughout your process, how did you all protect your own well-being and your mental health?
Yeah, I'll jump in. So that was a tough one for me when I was first diagnosed. Uh, I didn't want to let anybody know about it until the diagnosis was confirmed with subsequent testing. And even then, I wasn't sure of the outcome of the treatment or how I was going to respond to it. So I kept it pretty close. Um, as time moved on, um, what I recognized is that this was basically a new normal. And so in my head, normalizing, the fact that I had to incorporate this process into everything else that um, I wanted to do and that I needed to do to support my family, support myself, et cetera. So that was sort of a light switch for me. And so I focused on pushing myself to my capacity in that moment early on to see how much I could tolerate. and to see, um, if I could drive this so it wasn't a death sentence. And and that's how I approached it, mentally, as well as physically. And I will say that, treatment was tough, but I was blessed in many ways, but I did surprise myself from the standpoint of how much I could still do, even while I was undergoing treatment, and then subsequent to that as well. So I guess I would round that out by saying that, you know, chronic disease is chronic disease, and we adapt. The body is amazing. The human body is amazing, especially if you take care of it. So, uh, you know, um, but we can adapt, and if we're so fortunate as to make it through the rigors of what we have to do in order to get treatment, and then successfully get on the other side, then that's even more of a gift that we receive. So I'll stop there and let Jamie jump in.
Like Mr. Vix is throwing some shade at me as I battle a cold over here. I'm taking care of myself, I promise. Um, so anyway, what do I do to maintain my mental health and well-being? It's definitely a multi-tiered process. For starters, you stay off Google. Don't Google life expectancies. Don't do any of that kind of stuff. Couple of reasons for that. Your first thing is like, let me go look this up and see what it's about. But all of those sites and all that research is dated at this point. Like life expectancy is 4 to 6 years, so on and so forth. We're seeing lung cancer patients live longer and longer lives thanks to biomarker testing, thanks to science, thanks to research, thanks to God. So, for all of those reasons, you can't rely on what you see online as the end all be all for what your story is going to be. For me, I made that mistake early on and had to bounce back from it. Like the 4 to 6 years thing threw me for a loop, but here I am at year 7, and I'm doing great, knock on wood. So hopefully I continue on the same trajectory. But for me, I found community. That was one of the first things I did. Once I came to terms with it, a little bit like Reginald, I kind of kept it close to my chest at first too. But when I finally did reveal that, like, this is what I'm going through, and I let folks know what was happening with me, that was when, things started to change a little bit. I let folks pour into me with positivity and stuff like that. And it really does work. Prayers and all that good stuff, it all works and it all comes together for the greater good at the end of the day. So finding community was a game changer for me, but also taking a good hard look at myself and my goals was a big thing. So much of this disease is thinking about the stuff you can't do anymore or the things you didn't get to do yet and so on and so forth. And that's where some of that depression and where some of that sadness comes into play because you think, oh no, this is it for me and I'm not going to be able to do these things. But when you start to really just sit down with yourself and think about, okay, let's look at the goals that I wanted to do and that I haven't done yet. And let's look at how I can still do them even over and above this diagnosis. Like Reginald said, how can I push myself, as far as I can to make these things happen? And so once I came to terms with the idea of like, with my goals, is the end result more important to me or the process more important to me? And once I started to realize that the end result, as long as the end result was more important to me, it didn't matter how I got there. All that mattered was that I got there. So whether it's motherhood, whether it's getting married, whether it's getting this job, whether it's travel, whether it's, accomplishing this fitness goal, whatever that goal was, as long as the end result was more important to me, then me getting there was just a matter of, okay, let's figure out how I can do this with the disease. Like let's navigate around this obstacle in a way that allows me to still accomplish my goals. And I find that that is a very big mental boost in terms of self-esteem and confidence and just overall well-being, is knowing that like, hey, I'm still going to do all of these things despite the fact that I have this disease and this diagnosis. This is just one bad chapter of my story. It's not my entire story. And looking at it from that lens has given me a lot of mental health and well-being, just props and pep in my step, if you will. So I'll stop there and just see if anybody else has any questions.
Eric, do you have something?
Yeah, I just wanted to mention this and then echo what Jennifer is saying in the chat. She's, thanking you for sharing your personal stories. Is One of the common theme throughout all of this, and I hope if one of the things you've taken away out of any of this is just how impactful it is to hear from people who have gone through this journey. A lot of the connecting factors are about access to care, access to insurance, making sure that we have proper regulation in place to limit the amount of environmental factors, everything like that. Just going to show that how important it is that we work at the state, local, and federal level to ensure that we have this. And there's a lot of uncertainty going on. There's been a lot of change. But one of the things that really gives me heart is knowing that people can dispute facts or they can say, oh, what's the cost of this? But the one thing they can never dispute is your own story and how impactful that is and how strong that is. And whenever you do take opportunities like with the HEAL Collaborative or with your, if you advocating or you're participating in research, you're letting your voice be known and you're making a change, which not only improves outcomes for yourself and your community, but for the future, protecting all these things. So um, this has been wonderful. I know I'm here on the presenter end, but I feel very lucky to be listening to it also. So thank you.
Awesome. Thank you all so much. This has been great. I hope the information that you all have received has been, communicated well and taken in, and also, able to see how you can help advocate for those in your community and also yourself, or if you're a caregiver. So, real quickly, we're going to go through a couple of more slides. I won't go through all of these, but we can email these out. So, connecting community to lung cancer services. These are some services that are like in the greater Baton Rouge area, and also worldwide. Resources for care for lung cancer patients and caregivers. If you can go to the next one, Michelle. And here we just have a get screen flyer from the Louisiana Cancer Prevention and Controls Program. Just the different screenings that they offer, and also talking about lung cancer. And we can go to the next one. And also the Cancer Association of Louisiana and the services that they offer. And just to speed through real quick, Michelle. We can go to the next one. So, for Dr. Sanders, if you want to do a last spiel about the summit that's coming up, now it's your time.
All right, good. The summit is going to be in New Orleans. It's going to be a good time bringing everybody together. You've got the information here where we can talk to each other, learn from each other, and really do more work to improve survival for lung cancer across the board. I'm going to have to drop out, but thank you very much for this opportunity.
Awesome. Thank you all for joining today. And we'll get this information to you soon.
Thanks, everyone.